Welcome to episode 42 of New Indian Woman podcast, airing first in late May 2021, and I'm your host Krishna. Today we have a very special guest, Dr. Lalitha from Porgai, and I would request Dr. Lalitha to introduce herself.
I am Dr. Lalitha Regi. I live and work towards health with a community in Sittilingi Valley in Tamil Nadu.
For the benefit of listeners, Lalitha, you should focus also on what you do now, because when we say doctor, she's a medical doctor, and it would be good if you talk about the primary roles that demand most of your attention or priority currently.
Since 1 year, ever since the pandemic struck, our colleagues in the hospital here, we have a secondary level hospital here, tribal hospital. Our colleagues have kept us away from the hospital since we come under vulnerable age group for COVID-19. So my primary role in the last 1 year had been mainly in the Porgai Craft Center and with the bigger Porgai team of artisans in the villages. I am also associated and involved in almost everything in Porgai, from planning the production to reaching out to buyers and corresponding with them, both retail as well as wholesale buyers, planning the business, the financial management, etc. I also spend time along with our community health team, with the women's groups in our villages, and also with the farmers groups.
For the listeners, this may be a little confusing, right? I introduced her as Dr. Lalitha, as a medical doctor, but she's talking about Porgai and about community health and about farmers. And if you are wondering why, so that is precisely the reason why we are talking to Dr. Lalitha today, because it is quite an inspirational story. Before we get into that, why don't you tell us about what Porgai is?
Porgai is a society of Lambadi women artisans who have revived the traditional craft of Lambadi embroidery of Tamil Nadu. Lambadi community, they were a nomadic tribe originally from Afghanistan, and they were in Gujarat-Rajasthan border for a long time, and they migrated down with the Mughal army and settled in central India and many states in South India. So in Sittilingi Valley where we live, there are 2 villages which are Lambadi settlements. So they are no more nomadic. They are all settled and doing agriculture. All the women in the Lambadi community used to do embroidery for their own dress. But in course of time, when they shifted to saris, and this happened about 3 generations back, the craft also died down because there was no need for the younger people to learn the craft. Now, there are 2 women who had learned it in their childhood from their grandmothers. They don't wear the traditional dress, but they had learned the craft. And in the last 15 years, they have taught younger people and revived the craft in Tamil Nadu. And together formed into a society called Porgai Artisans Association. So on one side, it is a revived, rich, traditional craft. But on the other hand, it gives an opportunity for the artisans to stay in their own villages, work from their homes, and live a healthier, happier, and more dignified life. More than anything else, it provides them an opportunity to understand their self-worth. Yeah, that is in general about Porgai Artisans Association. And so the products that we make are all hand embroidered, and they are mostly garments, home furnishings, bags, etc. Porgai is an example of a fair, sustainable, artisan-centered rural enterprise.
Beautiful. I have been buying from Porgai and it is very beautiful. The embroidery is very different, but we are not talking to her because of why and how beautiful the products are. Lalitha, would you just go back and talk about how you maybe start a little earlier about coming to Sittilingi and also about the tribal health initiative, that hospital, and then Porgai. That journey, if you could share, that would be good.
Okay. We came here, Regi, my husband and I, along with another 2 people, now small team of 4, and our older son, he was 3-year-old then. We came to Sittilingi in 1993, 28 years back, because we wanted to work in a place where there is need in terms of healthcare. And we had shortlisted 3 places in tribal areas in Tamil Nadu, which were furthest from my healthcare facility. And Sittilingi happened to be that. So we came here and we found that there is a need when we listened to the people, and then we started working here. So we started with a small mud and thatch structure, 1-room structure, which the local people helped us make, and started as an outpatient clinic, which later developed into a hospital with inpatients and labor room and operation theatre and all facilities. Now it is a 35-bedded secondary level hospital with most of the major facilities needed for a secondary level healthcare. And the uniqueness of the hospital is that 95% of our staff are local tribal girls and boys. All our nurses, our pharmacists, our lab technicians, our hospital administrative staff, our drivers, everyone are local people who got trained. And at the same time, now we started training people in the community also, whom we call as the health auxiliaries. Older women, my generation, slightly younger, slightly older to me, and my generation here have not studied. So they are all not formally educated. So training them with the basics of healthcare to look after the basic healthcare in the villages. So this community health program was going on and the hospital was running for some time. So in 2004-2005, 10 years of running the hospital and the community health program, we needed more direction, what to do next. When we came here itself, we knew that unless we work on the determinants of health, the health of a community is not going to improve. But we wanted to know where we should focus on. So we almost literally closed down the hospital for half a week. Half a week it will work, half a week it will not. And the whole team walked from village to village, meeting every household and calling them for meetings in the evenings. And in those meetings in each village, we discussed about not illness, not about the hospital, but about health. Are we healthy in its wider meaning? And if we are not, then what are the reasons for it and whether we could do something about it?
So, Lalitha, sorry to interrupt here. So, how many villages approximately are we talking about here?
So, we work in 2 valleys in most of our work, which is hospital caters to a bigger area. But all our other work, we have 2 valleys. Our Sittilingi Valley, which has 16 villages, and another valley close by, which has 5 villages. So, 21 villages.
So, when you met with these villagers to find out about the bigger health question, the health determinants, what were your findings?
They talked about a lot of things, about lack of infrastructure facilities, lack of schools, transport, alcoholism, whole lot of things. But one major thing which in all villages they talked about is agriculture. They said that we know that our elders did a different way of agriculture, which are more secure, food secure and sustainable. But we were, knowingly or unknowingly, we were drawn into a modern way of irrigated chemical dependent farming also, along with the rain-fed farming. And we have, all of us have got into debts from which we don't know how to come out. So we know this is not good. We are not as healthy as our parents were, and we are all in debt. So we don't know how to come out of it. We know that it is not right, but we don't know how to come out of it. So this was a common response in all villages. So we said that, okay, since we know that there is an issue there, let us start talking about it. Unless we all start talking about it, there cannot be a solution. So let us have farmers groups where we can talk about issues of farming. And as a result of which, some villages came forward to start farmers groups. And that farmers groups later became bigger and developed as a society, which now is a society of 500 small farmers. Farmers meaning just 1 to 3 acre land holding, but 500 of them together as an organic farming society called the Sittilingi Organic Farmers Association.
Okay.
And also almost at that same time, 2005, 2006, we started also looking at livelihoods, because our people, when we talked to the people, they said that no, because with the small land holding and with reduced rains, it is difficult to sustain a household. So many of them were forced to migrate to towns and cities in search of work. And migration was bringing in money, but had a lot of health and social problems associated with that. So people felt that if they can be here in the valley and have half the income what they get elsewhere round the year, they will be happier. So we started looking at livelihoods. So a lot of women here value add to whatever the farmers grow, like whatever they themselves grow. That is one livelihood activity. And also Porgai also started at that same time.
Great. What started off as health has led to agriculture, organic farming actually, and also to reviving an art form and helping women find their self worth and so much more. An amazing journey. For me, when I first came across Porgai, I did not realize such a huge story. And much later, when I visited, I felt so happy and I felt so touched that there are people doing things like this. And for the listeners, and that is why Dr. Lalitha is here. And even today, Sittilingi is so far away. And to see that there is a hospital there and there is so much happening in that corner is touching. And if we imagine so many years back how it would have been, just a few of you, four of you decided to do something and you could make such a huge impact. Thank you so much for taking us through that. Headlines of that. It is not fair to ask someone who has gone through so much to summarize it in a few minutes, but still you've done that. Thanks a lot. I want to ask some questions more specific in terms of your own personal journey in this context. When you are so much part of a community and thinking about the community, it may be tough to think of your personal journey separately, but still, I'm trying to ask questions around that. I've heard many people talk about when they are in school, when they are in college, I want to become a doctor and I want to serve the poor, help the poor. But you see the same people 20 years later, 25 years later, what you see is completely different. Maybe they had to make so many life choices. So I'm very curious about your journey. So one thing is coming as a physician, you may not even have thought about all this kind of impact that you could have created. But even as a physician, when you started off, what made you choose to, go there to this, you were saying the most remotest kind of a place as far as health facilities are concerned? Is it something that you already wanted to do much before? Or was there some kind of a turning point, or was this part of your own self discovery?
Yeah, I think that a decision to work in a place like this, though there was not this much clarity, I think that decision came much earlier in the teens maybe, and without much thought. Because I would rather say that isn't it very natural and logical? I would put it that way, even today, for anyone. Because the ideal way to deal with anything is to understand the need and respond to the need. So the realization that the people who are economically poor in our country have needs which are not addressed properly.
Hmm.
I think that realization was to some extent there then itself. But that was a very raw understanding and dream. But later, when we worked in Gandhigram, we worked in a place called Gandhigram near Madurai in Tamil Nadu before we came here. There, we worked for 5 years and also meeting whole lot of people while in Gandhigram and also reading quite a lot about how to improve health with communities. It was not difficult to take the decision to work closer to communities where one is actually needed. Because I was very clear that I don't want to be the 11th obstetrician gynecologist in a town where there are already 10 people. No? Because there are so many people, so many women in India who don't have any healthcare services. No? Even for small things, no, whether it be obstetrics or surgical or medical, no facilities in several corners. No, so and all these places need help. So it became clearer over the years. That is how, even after coming here, there are a lot of clarity has come, even in the last 28 years after coming here.
But the starting point somewhere is there in what you said in terms of right from your teens, you wanting to look at the needs of others, need of me, I, me, myself kind of thinking versus the larger community. That thinking and reading is, I wish we had many more people doing this in their teens. You said that isn't this the correct choice? Isn't this the most natural thing to do? For you, it seemed very natural to do. But wasn't this more difficult than the conventional choices doctors make? What are the kind of challenges you face? You may have faced tons of challenges. I'm not referring to the sheer challenges of setting up that initial mud hut kind of a hospital, that one room hospital that you talked about. I am not even talking about that. I'm talking about the personal challenges. Dr. Lalitha, here in the context of the listeners, many women out there who want to do many things, sometimes the family members, sometimes the parents, sometimes there are so many others around you who try to hold you back. And that becomes a challenge. Hold you back because they feel out of interest, out of concern for your own welfare. They say, why do you want to take all these risks? Can't you do something like this straightforward? So that is the context of my question. So you had that kind of a conventional choices available in front of you. So, what kind of challenges you faced in taking this decision? But in taking the decision and then in pursuing that, at that time frame, could you just take us back there? And you were saying when you started this, your son was 3 year old. Not an easy time to go far away into some remote corner. So I'm very curious to just peep into your mind at that time, how it responded to whatever challenges you faced at that time.
Yeah, so that choice was for us, it was not difficult because that was a dream.
Okay.
And so the only thing is that we had to collect the courage to follow the dream. So that is it. So I think that is where most people differ because dreams most people have now, but then you have to jump and to follow the dream, you have to get all the possible courage to do that because I think we had that. And so there were challenges, but the challenges were very exciting, because after we came here, one of the main things were we couldn't even communicate. There were no means of communication normally, no phones, etc. Even to people, we had to go 3.5 hours, travel 3.5 hours to the nearest STD booth to make a 5-minute call and travel back 3.5 hours. No, this was, I'm talking about 93. So communicating even to the people who understand us and support us, there was no means of doing it. So you can write letters, that was possible, but one day you have a difficulty and you feel like talking to someone. No, so it was just both of us. And also adjusting to a very slower pace of life here, compared to what we had. That was another big challenge. And also developing the patience to wait till people develop that trust and confidence in us. So those things were challenges at that point. And for me, as a woman,
Mm-hmm.
I think the responsibility of planning and running the household, additional responsibility of that, in a place where maybe the nearest provision shop is 11 kilometers away, and you have to travel 3.5 hours one way to change your gas cylinder, things like that. Things like it was okay for them, people here, they were used to it, but you are
Yeah.
used to something different earlier. So
Huh.
adjusting to that and planning the household that way.
Hmm.
And when you're there with a 3-year-old with you, then it becomes all the more difficult. In a house which is bordering the forest, and where snakes inside the house was a common, regular, day-to-day feature.
My God, I
So to
can't
learn
imagine.
to
Hmm.
adjust to the practicality of living with nature, something which I romanticized till then. But then you have to accept the fact that not only butterflies and birds and flowers and trees are part of nature, but snakes and scorpions and centipedes are also part of nature, no? So if you have to accept one, you have to accept the other also.
I love the way you are putting it.
And so all this, all the more in the context of having a 3-year-old son with you, because the one thing
Yeah.
we brought when we came from Gandhigram, we have always stocked from day one anti-snake venom in our fridge. We
My
didn't have to use
goodness.
it for a long time, no. But the thing is
Hmm.
that you think about things like that,
Yeah.
no. So
Correct.
yeah, these were additional challenges as a
Yeah,
mother.
it is. When you talk about this, yes, there is the benefit of looking back over the years, but I also understand that you were living that dream. That challenge itself was a dream. I understand and accept it. But pardon me for asking this, but are you saying at no point during that time you felt, did we make this right choice? Should I go back and choose a much more comfortable option in a nearby town or something? Should I do something like this much later in life? Those kind of questions, did they come up? Did Dr. Lalitha have those questions in her mind? How did she deal with the temptations of more comfortable options? We will come back to these questions and more in the next episode. We will explore more about raising children in this remote village, her children's education, finance, how she adapted to the various roles that she has handled all these years, and the tips she would like to share with us. Please do not miss the next episode. And do subscribe so that you get a notification when the next episode is published. Thank you. Remember, you are what you want to be, and the time starts now.